Okay. There's call the meeting to order. There's no public comment today. Is that correct?
Correct.
Okay, I happened to read through the minutes from the last meeting on October 4th. I didn't see any issues with them. So unless anybody has any additions or corrections to the minutes, may I ask for a motion to approve the minutes?
I'll make a motion that we approve the minutes.
Okay, Bob. Somebody second? Somebody.
That would need to be Dr. Kelleher.
Yep, second.
Okay. Okay, all in favor to approve the minutes, say aye. Aye.
Aye.
Anybody opposed? Okay, the minutes are approved. Now I understand that we're going to start the agenda with the presentation from, I don't know, is Lauren doing it or Caitlin? I see Caitlin's here. Hi, Caitlin.
Hi. Yes, unfortunately,
I
Lauren's
presume this.
meeting got scheduled,
Pardon?
so I'll be giving the presentation today.
Okay, great. And this is regarding the health survey that we talked about a couple meetings ago. Is that right?
Yes, back
Okay.
in August, I think it was when we last attended your
Right.
meeting.
Okay. Well, then you can take the floor and tell us what you want us to know.
All right, beautiful. So last time we talked to you guys, we had just gotten really moving into the community. And I'm so happy to say that since that time period, we've been able to complete almost 2,000 community individual surveys with our residents in Reading. So from the time of July until October, we've completed all of our baseline surveys. And within those surveys, we also did the Kate Mobile Vaccine Clinic. And we were able to vaccinate almost 200 people within that time period by holding, I believe it was 9 weekly vaccination sites right on Penn Street in front of the Reading Community Pharmacy, one of our grant partners. What we have been able to do, let me explain the surveys before I get into some really cool facts and data to see about our community. One of our surveys was a COVID hesitancy vaccination survey. And with this survey, you had multiple options after the first round of questions. If you had received your first dose, you took one survey, and I can share my screen. All right, can everybody see that Word document?
Yes.
All right, this is our data. We are actually in the process of having all of our data analyzed from the 3 surveys through Penn State College of Medicine and Reading Area Community College. But with our COVID hesitancy survey, we had 487 people say that they in the community say that they've had at least one dose of the one of the COVID-19 vaccines. We've had 4 people say no, that they were scheduled for their first vaccine. Then we had one person responds with the answer of no, that they were trying to schedule their vaccine. And then we had 85 participants say no, they have not scheduled or gotten their vaccine at all. And with our grant funneling down through the Office of Minority Health, one of our main things to do with these surveys is to break it down by the demographics of our survey. So you can see with our highest number with the population in the city of Reading, people with the race or ethnicity identification of Hispanic was 391 of our participants with that survey. Their language spoken at home was only 161 versus in English versus in Spanish of 320. And as we got through the data down here, we go through our zip codes within the city as well. And we can see where with this data, how prevalent in the different aspects and zip code areas where we're seeing maybe more hesitancies with vaccines versus less hesitancy there as well. And then with our other survey, this is the HL or the SAL. We call it the SALI. It's this short answer health literacy survey. And with this one actually gave us a score of how many, or an idea of how many of our residents within the city of Reading have inadequate or adequate health literacy. And right now we stand of their scoring of 177 of the participants have an inadequate health literacy understanding. And with this survey, what was really interesting is that we actually needed our community engagement specialists, who I do have here with us, Enid, and our communications and marketing team, Latino Connection, doing face-to-face surveys with them where they actually had to engage and do a word recognition survey. So if we said the word, I think we explained this one before, where if we said to you, I'm going to give you a word and then I'm going to give you 2 words. You tell me which one closely relates to you. Your first word is kidney, and then your second word is urine, and your third word is cotton candy. Which of the 2 words closely relate to the word kidney? And that's very, very basic in general of how to explain the survey. But this allowed us to notice where translation verbiage really comes into a play with our community when it comes to understanding their health. And like I said, we're just in our baseline analyzation stages with our community partners of Reading Area Community College and Penn State College of Medicine. So I'm hoping come February, we will have a more detailed overview with a lot of correlations in which we've got to see as we were doing some data entry to see how many people who took surveys and they're unvaccinated, or who took surveys and their understanding of basic health terminology was very low in these scoring. But along with these surveys, one of the opportunities that we really got to have that was very interesting with our team was seeing how much participation there was with our CATE COVID clinic. Our beautiful team at Latino Connection was able to create this beautiful outline. Is that visual? I'm visually impaired, obvious glasses, but let me know if you can read this, and I can send this over to everybody. This is a nice little breakdown. We did 266 vaccinations within the city of Reading with our big mobile, the Latino Connection CATE mobile unit sitting on Penn Street. And here you can see the beautiful breakdown of which vaccinations were given, whether it was a booster, their first or second dose, how many, we had 152 men, 114 women, 8 was the youngest age that we vaccinated, and 89 was the oldest age that we vaccinated within their community. And then when we come down to our race and ethnicities within our population who did come and participate in our COVID vaccines, you can see that we are definitely totaling out right along with our census information that we've gotten from the most recent census about our population in Reading. We were able to, through signage on our CATE mobile van from their travels with us, they traveled over 24,000 miles and had a marketing impression for health literacy, the city of Reading, and its access and its ability to have access for its citizens and residents to have information on the COVID-19 vaccine, talk to a vaccination provider, and also learn more about making choices for themselves. Our next round down here is you can see each event that we did throughout those, I guess it's we did 20 events. That's right, 20 events, 9 in the month of October. You can see the breakdown here of how many people received their first and second dose per vaccination per event we held. So some of the events that we were held were not only just held at Penn Street, but were at local organizations that serve our community all the time. So a lot of our big community partners were places like the Salvation Army, the food pantry, local churches where people do the weekly food distribution, and then different local areas and events that the city had held and other organizations in our community have held as well. And we've been able to bring a really large presence and acknowledgement to what we're doing and how we're working to improve the health of our overall population. And at each one of these, oh, go ahead. Enid, do you want to jump in?
No.
You can at any point in time. Each one of these events or community places that we set up, kind of like set up shop with our mobile event, we were doing the health literacy vaccines, the COVID hesitancy vaccines, and the short answer health literacy vaccine surveys. And there, I can tell you from my own personal experience, this community was more than willing to participate and really wanted to share their message and their stories with us. We had nice activities, the Hands Across Reading, where we had them write down why they got vaccinated. And a lot of the answers were for my health, for my family, for a lot of reasons that were just for, one of my favorite answers is so I don't die, but it was for a lot of their community outlook, knowing that if they're vaccinated, they're not only helping themselves be healthy, but they're helping others to be healthy as well. One of our bigger surveys that we did was the health literacy survey. And that was a long form survey that went through the different dynamics of some of the social determinants of health when it came to gaining access, providing access, talking to your provider, feeling comfortable, access and translation, and all different aspects that we see in our community that can affect them and making healthier choices and working with their provider. I do have a beautiful research article on the development and the questions that we asked in the health literacy questionnaire. And just as a little bit of a background here, some of the questions that they asked, I know that had come up to see if you guys could see some of the questions, but here in this table 1, you'll see some of the themes that come in, the characteristics of relationships between their providers, trust and regular. Some of the themes in here, the skills of navigating the healthcare system, using cognitive barriers or strategies when accessing memory or feeling overwhelmed when they're in with the provider. It also asks about support groups. Do they have support? Do they have someone coming to an appointment with them if they need it? Do they have access to get to these appointments and talking to their provider? This has been one of our biggest, when we went through this survey and did this with the community, this is where we were able to really get some good data about how the community feels with the practices and just the healthcare system in general, and what their self-image and their lifestyle or their life can really impact how much of health literacy can be missed by just the general demands of everyday life that they struggle with, or challenges or barriers that they have there. So, does anybody have any questions?
Just really quickly. Oh, I'm so sorry. Does someone have a question?
No, go ahead.
Okay. Caitlin and I have to time when we're talking because we share an office. So we don't want there to be any like weird kickback. I just want to emphasize the importance of how this is a very base level understanding of data and a very base level representation of the diverseness that is engrossed within the city of Reading. And a lot of my job is to make sure that this work that we're doing now isn't a waste. That it's not like, oh, we did this and that's it. I'm thinking about long-term sustainability and having a health equity board within the city of Reading, as well as creating a toolkit that is accessible for not only the citizens in the city of Reading, but also the professionals who take care of the health of the people in the city of Reading, making sure that the city has a website that's specifically geared to someone's health and disseminating that information out to the professional working class that is working with this population. So keep an eye out for that. We do have social media right now. Actually, the very last bit of our website has been submitted to me. So that will be live in the new year. We can send that out to your next meeting, but that's going to be a really integral part of making sure that all the work that we're doing here is sustainable and can be utilized in the best way possible.
I'm a little confused about what you're showing us here. This appears to be in the literature.
This is the literature. Yeah. So this is the literature
I'm not
of
sure
one
how
of our
this applies
surveys.
specifically to your survey.
This is our survey. This is an overview of our health literacy questionnaire survey. This is
So
the
did you, in
general
other words, is this
overview.
yours, or is this something that was, scroll up to the top of this, where, where you can see what this is. Now, this is not an article that you originated from you, correct?
I wish, but no.
Okay, so am I understanding that you use this article and the stuff that's in it as kind of a model for what you did?
No, we actually licensed the health literacy questionnaire from a college out in Australia that designated this. This is an overview, and unfortunately, I did see in the meeting note in your agenda today that you wanted to see the questions of the health literacy of the surveys we were doing.
Yeah, I'd be curious to see that. I'd be curious to know if I passed.
You know what? Some of the questions were really, really difficult, that even some of them when I looked at it, I answered like, no, I don't feel comfortable, or I don't have access to this. And it goes to see how important it is to break it down to our population. And that's what this research article is just breaking down that. What are the topics in which we're looking for when we go into the surveys, and what's discussed in the surveys and the questions that are asked?
I think, John, this is part of a large grant that the area received to look at vaccine hesitancy and the impact of health literacy and acceptance of vaccine hesitancy. I was looking as you were talking, Caitlin, thank you for the work you're doing on health literacy. That surprised me that actually with vaccine acceptance, the city of Reading was doing much higher than a lot of the surrounding counties. So right now, it looks like some of the vaccine hesitancy is more in the areas outside the city. I think, more conservative, more, I'm not being political, but the data fares out more conservative Republican leaning districts of the area. The county had the highest rate of unvaccinated. And the city of Reading actually was one of the highest areas when you look at the zip codes of vaccine acceptance. So I think we correlated low health literacy with acceptance, but I think what we found in the state data of the city of Reading compared to surrounding like Birdsboro, Wilmersdorf, that we were actually a much higher acceptance of the COVID vaccine than some of those surrounding areas, which I think is an interesting thing to think about.
Do the health
Absolutely.
do the health literacy questions, some of them relate to, whether you know how to navigate the system or whether you can get the care you need. But
So
how much of it is related to just stuff people ought to know about their health? Like, is smoking healthy or unhealthy? Is being overweight healthy or unhealthy?
So
I mean,
the
is that
basis
part
of
of this, or is it specifically relating to their information with COVID?
The basis of this health literacy questionnaire was not necessarily centered on specific aspects of health, not too detailed. It was more generalized understanding of health. A lot of what Caitlin is sharing here in this BMC Public Health research article was what was utilized to formulate our questions. And these questions were created to reflect the population that we have here in the city. So like, I have one of the surveys here in my hand. Unfortunately, our online portion is no longer available, but a lot of these questions are, I have at least one healthcare provider who knows me well. I compare health information from different sources. When I see new information about health, I check up on whether it's true or not. These questions are simple and they're asked in multiple ways and different ways so that we can get a more concrete understanding in terms of data of how these people are managing their health systems. You have at least one healthcare provider who you can discuss your problems with. You understand the information that's given to you. You can fill out a questionnaire normally, like properly. You know how to read a medication label. So those types of questions, if you would like, we can definitely send everyone a copy of the health questionnaire to look through the questions if you would like to.
I'd be curious to see that.
Right.
I
But
think it would give us a better understanding of what the survey's accomplishing if we actually see the questions, or at least review
What our
them.
survey is, so our grant actually funnels down through the Office of Minority Health, but it comes from COVID relief funds. So right now, all of our surveys are trying to have mostly a baseline understanding of our population's basic understanding of health information. And then we're able to relate it down to COVID-19, where this, hopefully, I'm hoping this is our toes dipping into other topics about smoking cessation. So what we're trying to do through this HLQ is understand how, from the patient's experience, whether it's lifestyle, education background, reading level, how they understand their information when they go into the provider. So generally, most of our surveys and all of our grant deliverables are really focused around COVID-19 and vaccine hesitancies, but also patient experience. We have MOUs with local health providers where we actually go into these providers' offices and offer them an organizational health literacy assessment that is a self-assessment within the organization. That way, we're not only teaching and learning about our community and their health literacy, but we're also working with the certain providers to say, hey, take a step back. We're a team here. Your health should be a team with your provider, and we should make everybody feel comfortable. So we look at signage, we look at programs, we look at different things around the organization to make sure that those organizations not only are able to help them through the knowledge and medical outcomes that they need with the patient experience, but also making those patients feel comfortable and expressing, so that when they do go into a provider's and say, hey, I'm a smoker and I know I need to quit, they feel comfortable asking for nicotine replacement. And that's what our base thing, if we can use COVID to kind of wiggle into the space of health literacy within Reading, we could really hopefully, this will really hopefully open up the door to expand more information and more health literacy resources around other lifestyle or health topics.
Any other questions? The one example you gave about, kidney is close to urine or cotton candy, was that an actual question?
No, cotton candy was not. I don't remember what the other word was, but it was very similar where they would use words that were, one would definitely relate to the other. They
Oh, okay.
weren't that close in relation where, well, they weren't that obvious in that cotton candy does not
Okay.
relate to kidney, but that's the best way to explain
Right.
it,
No, I
is that we're
understand. You were
looking
just
for word recognition and word association.
And I assume everyone was asked in their native language. So, because if somebody asked me that question and it was in Spanish, I'd get the question wrong.
Yes. All of our
Okay.
surveys were offered in English and Spanish.
Okay.
Mm-hmm. And then with the Spanish version, we were actually able to use the class standards, the cultural linguistically appropriate service standards. There's 15 of them. So we went through our surveys and made sure that all of the language would match and meet those standards so that we were doing it not only in Spanish or standard Spanish, where you see a lot of your materials come in, but we were also making sure that it was culturally appropriate. And that certain words or terminologies that were translated into Spanish related to the culture of our community here.
And there are 15 different ones, you said.
Yes, there's 15 different class cultural linguistically appropriate service standards that we follow for all of our materials that we will translate into Spanish to make sure that it is a part of the understanding of those who are helping. That standard Spanish does not always translate to those who maybe speak a different dialect or from a different area that also is a Spanish speaking area. Mm-hmm. We really want to get there. Oh, go ahead.
Were the people that took part in the survey limited to people in the city?
Yes, we tried to stay within the zip code of 19601 through 19604. We wanted to get it. We would have loved to get in a broader zip code range to see that correlation between kind of the outside of the city limits and the inside of the city limits. But unfortunately, our grant is running a little behind to meet our deliverables with everything. But I mean, our team has been lightning and we've been able to hit them so far. And again, we are in the process of working towards an extension of this grant, which then can allow us to hit those areas and zip codes outside of the city limit zip code.
What's the end point in your this whole process? Do you have a specific date, or is it when you run out of money, or?
Our specific date is June 2023, the end of June 2023. So we're about 6 months away. I can't believe it's already December, but we're almost about 6 months away, and we are actually in the process of planning out the next 6 months, where we will be doing focus groups with participants from our community, where they'll evaluate health materials on COVID-19. They'll get a strong voice in these focus groups about how these materials that are circulating in our community relate to them, how they can be improved. And then from that data and all of our survey data, we then revise these COVID materials, that are handed out in offices or you see floating around, posters, making sure they're up to date, making sure they meet all of those 15 class standards, and that they're hitting this health literacy level, which our community is. So idealistically, we want to think that our community's health literacy level is at a 4th grade reading level. So that's what we've actually kind of been able to learn through through this preliminary baseline data. That if any of the material that is handed out on average or a certain percentage, most of our residents and citizens are reading this health material at a 4th grade education level. So our end goal really is June, and what we're planning on doing with that, we're going to hopefully throw a huge party, a big thank you for our community, but also a beautiful event to share all this data and see how it wrapped around and has come together, making these toolkits for the community, making toolkits for our organizations and setting our organizations up to improve their health literacy continuously. Also with that, we are also developed a health literacy training with Penn State College of Medicine that is geared towards community health workers. And this will be like continuing education credits for that community health worker certification, which is another big up and coming position in the medical world. As like patient navigators and people working within the systems to support patients one-on-one. And this will be able to teach those community health workers how to address health literacy, but also help the people that they work with understand what they're getting from a doctor's appointment or learn how to advocate for themselves within a doctor's appointment.
All right, anything else?
Dr. Kelleher,
Yeah.
you mentioned that there seemed to be a higher acceptance for the vaccination among city residents. Are there any hard numbers percentage-wise concerning the acquirement of the COVID virus, city residents compared to county residents?
There are some numbers, including like breaking it down by hospitalizations and deaths. So a lot of that data is from the initial pandemic that showed that people of color were more likely to die. And I think a lot of that was related to being essential workers and having to go to work while others did not. But the elderly white population was one of the highest fatality rates, but for young people with lost years of life, that was actually much more common in people of color.
Thank you.
All right, well, thank you very much for the report. I'd ask you one final thing. Have you learned anything so far that you didn't know beforehand?
Oh, that I didn't know before?
And I know that's not the whole point or the purpose. I was just curious as so far whether your eyes have been open to something that you heretofore wouldn't have suspected as being an issue.
I think for me personally, one of the biggest things that I've learned is how quickly I can spend money, spend money within the community to do something good for them, and be able to provide them access. With my background, I was actually a health coach with Berks Counseling Center for the last 3 years, working face-to-face in the community and understanding how far health literacy actually goes was one of the bigger things, and how many more programs really need to be in place, and different things like the board, like a health equity board, to make sure that we're having equal access to healthcare for everybody. I think seeing the gap there was one of the biggest things that was a big learning experience for me. But learning how much and how how much is $4 million is a lot of money, but it's not a lot of money in the grand scheme of health literacy. We can only do so much. So learning about what the community needs and how much access and how much easier access that they need was a big kind of eye opener for me, especially working individually where I'm working with the people of community where English is not their first language, and they went to their doctor and their doctor said, hey, you have high blood pressure, you need to do this, that, and the other thing, and here's the pamphlet. And then they would come to me as a health coach and say, hey, the primary care gave me this. I don't know what it means. I don't know what any of these words mean. And it just goes to see how important it is to make sure we make those materials and have those conversations on levels that patients and community members can really understand so that they can make the educated choice on the outside world. So.
All right, that makes sense. Well, thanks very much for your work. We'll be anxious to hear. You're going to report back then in July or June, whenever it's over?
Absolutely. We can always come earlier if you would like. We'll have a lot more.
Yeah, if you have any important updates,
come this
if you
spring.
think you have some important updates, sure, we'd be happy to host you again. Thank you.
Beautiful. Thank you so much.
Okay. Do we have a health inspector's report today?
It doesn't seem that anyone is here today.
Okay, I did see the report that you submitted from Mr. Sininsky, just talking about the COVID stuff, and it sounds like everything's under control. He reported that we're not seeing, I was going to ask Dr. Kelleher this, how, so many of the news articles are talking about the trifecta now of the COVID with the RSV and the influenza. How I know we're still being hit with COVID. How's our community in regard to the other two ailments?
Yeah, no, it's definitely had an impact. Deb Powell, the infectious disease head at Cara Health, sent out a notification that their hospital capacity was in the high 90%. And it's trailing down a little, but especially in the pediatric ICU beds in not just our area, but surrounding areas, Philadelphia and Hershey were at capacity with the RSV. So we're definitely seeing it. RSV is kind of decreasing at the same time that influenza A is making its peak. So I just presented to the staff that we're peaking with influenza A at a rate that's much higher than the previous 7 years. And so not just COVID related mass decrease years, but in years prior that influenza A is on the rise. So it does look like it's starting to impact our community with all three of them circulating. I looked up prior to this meeting, there's 38 inpatients in the hospital with COVID right now, 5 in the ICU, 2 on ventilators. So it's clearly not gone within our community.
All righty. Well, I was kind of hopeful, the flu has made a presence much earlier than usual. You wonder if when you get into the traditional bad months like January, whether there might be more people got it early, but that's probably wishful thinking.
Yeah, no, it's a pretty steep upward curve. I just presented it to our all staff because we have a very low acceptance of flu vaccination. We don't mandate it like the Tower Health system does. And so it really is kind of scary if it continues that upward trend, how many people will be affected.
All right. All right, on to other old business. Is there anything update on the lead abatement program? Do you know, Shelley?
Jeff, do you want to provide an update?
Yeah, currently we have 10 people enrolled. We completed 5 lead LIRA inspections. We're actually working on the RFP with the city of Reading for lead abatement companies for next year's lead inspections and relocation. That's basically where we're at now, working with the RFP to reach out to local contractors to do the lead abatement work. So we're moving forward. Hopefully we have 10 now, and we have 2 interviews this week. We have 3 more people coming in with their, to see if they qualify. So hopefully, we'll keep moving forward with the lead abatement program.
All right. Well, thank you.
Yep.
Any information, I know this has been dead topic for a while, the county health department, Dr. Kelleher, I know at one time you were involved with conversations. Are those still going on, or is that a
They are.
dead topic?
We did a focus group just this week, Monday. Was it today's only Tuesday? Was it really just Monday or late last week on the county health department? They didn't call it that, but you could see that it's still ongoing. They contracted with a firm to do kind of focus groups throughout the county and to collect information and data. So I'm not sure when they're going to be reporting, but they are definitely still out there collecting information about the benefit of a centralized health department.
All right. So one thing that's not on the agenda, but I know there was a flurry of some emails concerning it, so we might as well talk about it for a moment. And that is the subject of, somebody raised the question at I guess a city council meeting, that it was hearsay that somebody had necrotizing fasciitis, or like the press would hear, flesh-eating bacteria. And I know a couple of Dr. Kelleher, I think you weighed in, and the other physician did as well, Jessica Schwartz. Did anything, it sounded as though you guys didn't hear of anything noteworthy. I know throughout my whole career, I was on the lookout for that, never saw it, but I would think that if a bona fide case of that came up, that ID would be all over that and people would know about it. Any comments now that I brought it up regarding that?
Yeah, I think the rumor mill was out that it was due to Blue Marsh Lake and some of the algae and all of that. I don't think that borne out. There always could be, I guess, a case of necrotizing fasciitis. I'm sure as an orthopedic surgeon, you probably saw some of those nasty cases in your career. But as far as an outbreak and epidemic, I don't think there was any evidence that was ongoing.
Okay. All right. All righty. And then I guess the only other new business is next year's meeting schedule. I guess we'll still stay on the same track for the moment, unless we have other reasons. So we'd be looking at what do we do, the first Tuesday of the month, right?
Yeah, it's the first
So that
Tuesday
would
of the
be-
month for February,
That would be
April,
February
June.
7th. Yeah, that would be February 7th.
Yep,
So should we consider that's the date unless something comes up to the contrary?
do you want to stay
All right.
virtual?
Yeah, I think so. I mean, it just seems like we have better attendance. I don't feel like we gain a whole lot of being in person. I wouldn't be there today. I'm at home with COVID now. Yeah,
Cases on the rise.
I dodged it this long, but I tested positive on Saturday morning. So, but I didn't get too sick. I had a little fever and chills, but I was out working in the yard today, so I'm doing all right. So, yeah, I think for the moment we should, especially, if we, who knows, we might get a cluster of, look what happened last year in January and February. Things seem to tick up. So for the moment, maybe when the summer comes and it's all gone, we'll have an outside beach party agenda. Yeah, meet somewhere outside. Anything else for the good of the order that anybody wants to discuss or bring up? Nope. Well, then if that's the case, can I have a motion for adjournment?
I'll make a motion that we adjourn.
I
Okay,
second it.
somebody second?
I
All
did.
right, anybody against? Okay, well then we'll see you in 2 months unless something comes up in the meantime that we need to address. We're always here. All right, again, thank you, Caitlin. Appreciate your presentation today.
Thank
Thank
you
you,
so
Caitlin.
much.
Bye-bye.